Number of people now eligible for a COVID vaccine here in Massachusetts has doubled, and so your questions have at least doubled, maybe tripled or quadrupled. So here to answer some of them is Dr. Todd Ellerin tonight, Chief of Infectious Diseases at South Shore Health. It's great to see you, Doctor, as always. So people with at least two what we call comorbidities can register for the shots. We've received a lot of questions asking why type 2 diabetes is on the state's list, but not type 1. So is the risk different?
Ed, that's a really good question. And here's the bottom line. I mean, it's confusing, but there's about 15 to 20 times more diabetes mellitus type 2 than type 1 in the United States. And patients tend to be older with type 2 diabetes, and they tend to have more of those comorbidities like heart disease, obesity. So if you were comparing them, you would say overall patients with type 2 diabetes have more severe outcomes, but we do know that patients with diabetes mellitus type 1, first of all, they can be older, and they can have more severe outcomes as well. So this is what I'm going to do. My partner, Dr. Wild, sits on Governor Baker's COVID-19 vaccine task force. I'm going to ask her to take this back because we do want to always have quality improvements, and it's a little confusing.
Perfect.
Hi, Doctor. Thank you for joining us. We always appreciate your insight. We really do. Smokers, can you explain why they're on the list and what's been your experience with these patients after they develop COVID symptoms?
All right, so the first thing I want to say is all of these risk groups, most of our patients who come into our hospital, they leave in one piece and they do well, okay? So we're talking about relative risk. So what the observational studies show is that patients who are hospitalized and smokers tend to have worse outcomes than non-smokers. Again, these are observational studies. They're not perfect studies. So far, the data is if you're a smoker as an outpatient, it doesn't mean you're more likely to get hospitalized. So that's it. And pretty much smokers is included because of that, the data that we've seen on hospitalized smokers.
So here's another question that we are getting. Is it okay, for example, to get the COVID vaccine if you were recently vaccinated for shingles?
Okay, so the answer is yes, but generally we're waiting 2 weeks on either end if you get any type of vaccine. So that's the important part. You want to wait 2 weeks. Why do we do that? It's not that it wouldn't be safe, but we want to make sure, given the fact that the COVID vaccine's new, we don't want to have side effects that might have been from the other vaccine and blame it on the COVID-19 vaccine. So yes, but wait 2 weeks.
Okay. Any reason why someone should call their doctor first before they get a vaccine, or should they just go and get a vaccine because it's safe for everybody?
All right, so for 99% of people, when you know you're in a high-risk group, you just want to make the appointment and get the vaccine. But here's an example. A patient called me today, and they said that they had anaphylaxis, the most severe form of allergy from the flu shot. And they were calling up these different mass clinics, and they were saying, no, you can't get it because we don't have the capability just in case something happened. That's an example of a good question that you'd want to call your provider with.
So how did you answer that patient?
We're going to send her to allergy first and have a consultation. And then by that time, hopefully we're going to get her a place where she can get vaccinated.
Dr. Ellerin, it's always great to talk with you.
Ideally in a hospital setting.
Right, just to watch, right.
Great to talk with you. Thank you for your time.
Thank you, Doctor.
Great to
Stay
see you.
well.